I am Dr. Nihad Salifu, one of the first beneficiaries of the Merck Oncology Fellowship Program. I trained in Tata Memorial Hospital for a year and returned back to Ghana. I am currently the lead clinician at the Pediatric Oncology Daycare Unit at the Kelej Teaching Hospital. For about a population of 30 million Ghanaians, we have less than 5 trained pediatric oncologists in the country. So my training and return back to the country was a welcome relief to add on to the overburdened pediatric oncologists. In my center, we see close to 200 patients, newly diagnosed patients in a year. And currently, as the lead clinician of the Pediatric Oncology Daycare, we see about 80 to 100 patients a week. And the overburdened oncologists had to be running between the ward and the Pediatric Oncology Daycare prior to my arrival from India. However, now they have been relieved of that stress because there's a trained person who can keep an eye on the daycare and ensure that processes run through properly. Patients are seen promptly. They are given their treatment as scheduled. The follow-ups are done in accordance with protocol. In addition to patient care, I also supervise and take part in the training of younger doctors who pass through the units. As a Merck Foundation alumni, my training has opened so many doors for me in terms of my career development. As soon as I arrived home, I had the opportunity of getting enrolled into the Ghana College of Physicians and Surgeons as the first Pediatric Oncology Fellow, and I'm currently in my 3rd year. Secondly, upon completion of my training, I was immediately nominated as the co-chair of the PODC working group on twinning support and collaboration. And that has given me the opportunity to work with many acclaimed pediatric oncologists worldwide. And on the global front, I'm involved in developing twinning guidelines to enable centers, especially in low and middle income countries, to have partnerships with well-established pediatric oncology centers all over the world. In short, I would say that the Merck Foundation has given me one of the best foundations any pediatric oncologist in training will be yearning for. So for my patients who are children, they are always very excited to come into the Pediatric Oncology Daycare to see a known face, a permanent face, something that they did not have access to because doctors here used to rotate through the unit and there wasn't that person who was always on the ground. Now my patients have that kind of continuity of care from somebody who knows them and then sees them throughout the continuum of care, and even after, when they come back to have their follow-up visits, I am always around for them. So for a child, the child needs to have some level of, continuity, some level of a permanent face, somebody who knows them and be able to follow them through. In conclusion, I would like to say a huge thank you to the Merck Foundation for giving me this training. It has opened doors for me. It has given me very firm grounds to spring into the world of pediatric oncology. It has given me access to more training. It has given me access to more opportunities at research, even internationally and then back home. I have known so many pediatric oncologists within a short time, just during my training and shortly after. all because of the Merck Foundation. So for me, my career has been put in place by the training I received from Merck Foundation. I would like, on behalf of my patients and their parents and caregivers, to also say a huge thank you to the Merck Foundation, because it has given them access to more optimized care than they would usually have if less trained people were on the ground. And for the country as a whole, I know that our ministry has appreciated the Merck Foundation's role in training pediatric oncologists for the country. I have finished my training. Another person is currently training in India. And for adult medical oncology, another person is also in Cairo, in Egypt, training. So the Merck Foundation has actually opened the grounds for more people to be trained in oncology in Ghana. And as it is now, the Ghana Health Service has a strategy to put in pediatric oncologists, at least one in each of the regions in Ghana. And I think the Merck Foundation has provided the grounds for that to be done in a very well, thought out fashion. So I would say that the Merck Foundation has provided visionary leadership for the development of pediatric oncology, not only in Ghana but in Africa, because our local problems here cut across the African continent.